Hi, everyone. Thank you so much for sharing your lunch with us here today. I'm Bridget Gavaghan. I'm with the National Human Services Assembly, and directing an initiative that's really meant to provide a collective voice for the work that we do as a human services sector. These were some network discussion questions that we thought if the room was too quiet and you guys weren't talking to each other, we'd prompt some conversation, but that was obviously not a challenge with this group. So, but I do want you guys to kind of think about, as we're talking about a way to engage the public and engage policymakers more effectively in the work of the sector, human services, social services, think about what challenges you've experienced when you try to talk about your work and the work that you do in communities. Think about, if there's one thing that you wish that the public knew about your organization or about social services, like what would that be? And then if there's one thing that you wish the public did not know or did not think or believe about our work, we're going to talk about a lot of that today. I do want to make sure we're a small enough group now, even though I'm kind of up here and I've got this lapel mic and it seems all formal. I hate kind of formal presentations, so please, if you guys have questions or, we can keep this as conversational as possible in the room, right? So please just jump in, stand up, raise your hand. I'd love to, we have a formal Q&A at the end, but I'd love to weave that in throughout as well. Sound good? Absolutely. All right. Okay, so National Human Services Assembly, the organization that started this initiative to reframe human services, we are a membership organization for other national groups in the sector. And really our members, and this is just a small sampling, a nonprofit Leadership Alliance is one of them as well, they really represent all the different strategies that you could think of when we think about social services and all the different populations we could think of. So whether that's through early childhood development, whether that's prevention, whether it's advocacy, research, planning, right, social work, that's all encapsulated in our membership. Very diverse group, right? But all working towards fostering well-being in communities across the country, right? So this kind of broader goal is there for us, but we're doing it in very different ways. But one thing that we share as a sector is we struggle to engage the public and policymakers in meaningful ways in our work. Does that feel true to you guys? Yeah, so here's how this is playing out for us. We've experienced, at best, level funding for our services, at best. But over the last several decades, really what we're looking at are cuts in public funding, right? We're looking at policies that are being developed without our input and our valuable insights into how they should function. And we're seeing stagnated charitable giving as well. So several years ago, our members, our board, we understood that this was happening for all of us. This was shared across the sector with some minor wins here and there, right? But we really wanted to understand why, because we know how valuable our work is in communities, and we know how valuable our work is to society. But it seems like it's not really translating. So we didn't want to sit around in a room like this amongst ourselves with our peers and come up with that great new slogan or tagline that we thought was going to work. We wanted to have a deeper understanding of what was driving public engagement or lack thereof. So we engaged an organization called the Frameworks Institute. Anyone here, have you guys heard of Frameworks? Couple hands, good, so I can tell you all about them. So they are essentially a think tank for communications, and they take a really unique approach that is evidence-based. So they look at qualitative and quantitative data and research, and they want to understand not just what the public believes about a particular issue, but why. So why does the public think in a certain way when they think about human services? So yes, they have kind of communications experts on their team, but they also have cultural anthropologists, they have social linguists, they have political scientists, and they're all trying to get at that question of why does the public think this way, and what's a different story that we can tell that is more motivating and activating for the public. That make sense? Okay. So in their first phase of research for us on our behalf, Frameworks went out into the world and asked people outside of our sector, what do you know about human services? Why do you think people need to access these services? Who do you think benefits, right? And they did that through focus groups, and they did that through one-on-one interviews to try to get a sense of what's the public story when it comes to human services. And we're going to show a quick video that gives you a nice summary of their findings on that.
Why do you think that some people have more difficult lives than others?
Some people make their lives more difficult by the decisions that they make.
Individual choices.
The amount of work that you put in, I think.
Effort, motivation.
Some people, I think, make their own trouble.
People don't understand mostly is that what you do now affects later.
Wherever you end up, wherever you are at the time is a result of how much work that you invest.
They should also try and help themselves too. I think they shouldn't try and play the victim card.
Everybody has the option to change their destiny, and you have the power to have it better.
People have to help themselves.
A lot of it has to do with the situation of their parents. Who you know, how much money you have.
A lot of it's about money.
Low wages. Sometimes when you've lived in debilitating environments, you don't have a hope for support. And so you don't go after it.
You heard the phrase human services?
No.
Human services?
No,
you heard
I
that phrase?
Is that a general term? Yeah, I'm not entirely sure.
Human services?
Yeah.
We all serve each other.
The phrase human services pertains to people helping people.
Handing out food, clothes, different things.
Well, I do know they have the food.
They're always giving away food and supporting people in that way, I think.
For people who are not doing really well, like they don't have a place to live.
Very kind people.
There are people out there that are less fortunate than myself.
Charity organizations to help those that can't.
Healthcare for the homeless, or just the food kitchens.
If they're in a tough time, maybe money to help them get over whatever it is that they're trying to get through.
Thank you. So first of all, anyone surprised by what you heard in this video? Does anyone want to share some thoughts on what the public seemed to think about our work? Yeah.
So last night I was being driven around in the Lyft, and I commented on the people who were sleeping under the overpass to my Lyft driver, and he said they choose to be there. That's their decision. They have the ability to get out of this situation.
Yes. So if you guys couldn't hear, she was sharing that even in a conversation with a Lyft driver where they drove by some people who were homeless, the Lyft driver said, that they chose to be there. So you hear a lot of that in the video, right? Individual action, individual choices, driving, people needing to access services. What else?
I heard people mention food over and over, but it's not just about food.
Yeah, very basic understanding about what is included when we talk about human services, food being the biggest thing that came up in this. I don't know if it was at lunchtime when they were talking to these folks, but they were very convinced that food was, and food is important, but how did they describe the people who were providing food? Yeah. Right. Right. Yeah, so the total focus on that individual and whether or not they're worthy. Right. Yeah. Charity. Yeah, exactly. So this is a conference for, do you guys call yourselves the National Charity? You're professionals, right? You're professionals. And we work with a lot of volunteers. And we respect and honor our volunteers, and we appreciate their help. But we are professionals. We have expertise and training that we provide to a community. But did you hear that at all in the story from the public? No. Yeah, in the back. Yeah. So even within our own field, there's some confusion around terminology. You raise a really important point about the term human services. The public really didn't know what to do with that. Frameworks refers to this as a cognitive hole. And as people, we cannot live with, it means they have no information. You have a cognitive hole that's a space that's unoccupied. And so we very quickly try to occupy that space. As you saw people reasoning out in the video, that happens in a really remedial way. Basic needs conducted by volunteers for people who made bad choices. Somebody else, not me. Is that the story you guys tell about human services? Your work? No. So, as part of phase 1, frameworks didn't just go out to the public and ask, they asked leaders in the field, well, how would you describe the sector, the value of the sector, why it's important, who benefits, et cetera. And what they identified were essentially these big gaps in understanding between how the public views our work and how leaders in the field view it. So these are the big 4 gaps. And you can find this report on the Assembly's website if you want to dive into it even more, but I just want to walk through these because they're really important to us when we think about how we communicate with the public. So those of us in the field, leaders in the field, when we talk about the scope of human services, we include some of the direct services you heard in that video, but we talk about prevention, we talk about advocacy, we talk about research, we talk about planning, we talk about how we're promoting health and well-being, right? But the public, they don't see that. That story has not been told to them in a way that sticks with them. So they see those very basic direct services. So what causes somebody to need to access human services? Why are we necessary? So in the field, we really like to point to context and systems. What are the institutions that are at play? What are the policies that are in play, right? But that's not something that the public is aware of. So they really see, as you saw in that video, the individual. They cause themselves, right, through lack of resilience, lack of willpower, lack of grit, determination, right? Their fault. So then who's responsible? Well, if we think that there are systemic challenges, then we think that there's a role for civic engagement. We want our policymakers, we want our community leaders, we want our academics, right? We want our experts in the field collectively addressing the challenges. But because the public thinks that the individual is primarily responsible for getting themselves into the situation they're in, they are primarily responsible for getting themselves out of the situation. We are not included in this story. And then finally, and this is a really important one for us, this really limits engagement. When we talk about who benefits from human services as a field, and we heard that this morning, we heard Kevin Washington talking about this, it's not just the people who participate in the Y programming, it's the entire community that benefits from the Y being available, right? So this is what we know to be true. Entire communities benefit when robust human services are available and operating and functioning in a healthy way in their communities. But you guys can see the kind of obvious logical approach that the public is taking here. The individual caused themselves to be in this situation, they're primarily responsible for getting themselves out of this situation, and they are primarily the beneficiaries of the work that we do. So anyone want to take a stab at why this might be a challenge for us? These big gaps? Yeah.
Funding, getting people involved volunteer-wise, policy-wise. Sorry if I answered all the questions, but just
Yep.
Everywhere across the board, if the public doesn't think what we do has value or is important or think they need to support it, that makes the road a lot harder.
Exactly. Very simplified way. Yes, perfect. So what it tells us, oh, sorry, over here you wanted to?
We don't brag about ourselves.
Ah.
We spend so much time focused on our mission, and focused on what our goal is, that we fail to remember to brag about our industry as a whole and the collective good that the sector does for society.
Yeah. Yes. Did you guys hear that? So his point is we don't brag about ourselves enough, and I would put it this way: we don't talk about our solutions, right? We don't convey that we have the answers or we're working together to get the answers to the public. So What this all boils down to really is that we are not our audience. And we have some work to do to be a little bit more explanatory, to fill in some of these blanks, to bridge some of these gaps. So because we're not our audience, we might say something that rationally we know is correct. Right? And by the way, all the messages that I show you, and I'm only going to show you a few, but they're all real messages that came from our partners. And they said, don't tell anyone who it is, but yes, you can take this and you can tear it apart in your presentations and workshops. So we are. Okay. So in these tough times, people need more support, not less. This is no time to cut funding to human services. Okay, so we might agree with that, but because of the public's understanding about why people access services, who benefits, right, here's how this gets translated. So yeah, these are tough economic times. People who get those programs have better quality of life than the rest of us. Must be nice to have someone else pick up the tab. I'm going to tell you that this is not an exaggeration, and you would know that if you had Thanksgiving dinner at my house. So it's a challenge, right? So this might be slightly exaggerated for some people, but what does this tell us? The public thinks somebody else is getting the benefit. It's us, the good people who are providing our funding, and them, those who are taking it. Makers and takers, us versus them. Right? And nobody wants to be the them. So why does this happen? There are a few reasons. It's not just because there are bad people out there that we have to just throw information at, because we've tried that. We've tried throwing information at people. But here's the thing. We have learned over the last couple of decades more and more about how our brains function, how we process information. And one of the really important ways that we do that is we take mental shortcuts. So mental shortcuts are necessary. We are taking in so much information at once, we can't possibly make intentional decisions about everything. But they are really based on our beliefs. And they are so powerful and so strong that we will reject information if it does not comport with our belief system. This is especially true if data is unframed. If it's untranslated for people, they're going to translate it using their beliefs. And we're not even aware that we're doing it. I see a hand in the back. Mm-hmm. Yes. Mm-hmm. And as a result, it's never a matter of, hey, maybe maybe it's not a level playing field. Maybe that's the problem. Mm-hmm. They don't hear that until much later in life, mm-hmm. And then they don't believe it. Yeah. So you've nicely segued to the next part. So what are the stories that we tell as a society, us included, those of us in the room included many times? The stories that we tell as a society create something that's called a cultural model. There are ways that we help understand and reason through issues that are shared, and they are based on generations-long stories that we tell. And this is a dominant cultural model in the United States. And it's a dominant cultural model for our sector, for the way that the public thinks about our sector. And I want you guys to think about this image and think about what the woman in the back of the room said. And tell me, what do you think that this image is? What is this cultural model? Rugged individualism. What's that? Bootstraps. Yeah. This is a dominant American value. It's a story we've told about our country, about our society for generations. And we might rationally look at that and say, oh, no, nobody does it on their own. What is even a bootstrap? I don't even know anymore, right? We might rationally think that, but it is informing deeply our processes behind the scenes so that we can be seen as undermining this deeply held value. This is another dominant cultural model for our sector. Any thoughts on what this could be? hear murmur, murmur, murmur. End of the world. Armageddon. So we use a lot of dramatic, crisis-laden language meant to engage people, right? Meant to engage the public, meant to engage policymakers, meant to kind of shock people into action with the urgency. And the truth is we feel that urgency. But remember, we're not our audience. So a couple things can happen. The cultural model that crisis language can cue up is called fatalism. So we talk all about the problems. We don't promote what the solutions are. We talk all about the problems, well, too big to solve. It is a regrettable social condition, not something we can do about it. So that's one side of it. The other side of the crisis language is it can cue up skepticism. So you've been saying that the sky was falling. But because the public doesn't really see how human services impact them on a day-to-day basis, they don't really see the sky falling. It's not a direct link. And I think about this, so I live in Chicago. Is there anyone here from Illinois? All right, yeah. So, yeah, except for the over 2 years that we went without a state budget. And every day you could see a piece in the local papers about, and it was true. Okay, again, the crisis was real because human service organizations were not getting paid on time through their contracts, but they were still providing services. They were shutting their doors. They were serving fewer people, so that was real. But the crisis language that was used, for most people walking out of their door every day on their way to work or whatever, they didn't see the direct link. So that you start to tune it out. So crisis cues up fatalism, too big to solve, or it cues up skepticism. Yeah? Yeah. I saw some of that happen too. I talked about the contracts, when they were able to make an analogy between when you wouldn't treat a business like this, right? But businesses, you create a contract with them, you have cost of living adjustments, right? That was something that people could understand because they understand generally how that works. We're going to talk a little bit about that in a minute. Yeah.
I also feel, whatever your funding model is coming from, so I would primarily put an organization that relies on individuals to fund us.
Mm-hmm.
And so I feel like we actually stab ourselves in the foot because we're saying what we feel like they want to hear.
Mm-hmm.
So we're actually reinforcing stereotypes. We're reinforcing this charity model because we're afraid that if we don't say certain things, we won't receive funding.
Yes.
And so the honesty, at my organization, we're having a lot of very deep conversations about how to have more honest conversations.
Mm-hmm.
Because how does that only help and provide better solutions, but we're actually stabbing ourselves in the foot.
Yeah.
Of how we talk about it.
Yeah. Yeah, and do we really know that that's what our donors want to hear? That's the story that we've been giving them this whole time, but we don't know how high the bar could be set if we told a different story. We have some research to indicate that it could be set much higher. So I want to go through, every time Frameworks does their analysis on an issue, they develop what they call their swamp. These are all the very easy to think things for the public. Very easy for them to think about our work, very unhelpful when they do. And they've been part of the dominant story about our sector. So I'm just going to walk through the quadrant. When we talk to the public about well-being, and you're going to start to hear me use that term a lot more. So we mentioned that nobody knew where to go with human services as a term. So Frameworks tested out a few different ways to start the conversation, and well-being was a very productive starting place because it's a broad enough outcome to encapsulate the entire sector, so it's not limiting. And the public had a general idea about well-being, what it looked like, at least a better idea than they do for human services. But it's still somewhat limited, so we do need to be aware of some of the limitations around when the public thinks about well-being. So primarily, when you talk about well-being to the public, they think about financial self-sufficiency. And we heard that in the video. So what's the solution then? What do people need to do to be financially self-sufficient? Get a job. That's it. That's easy, done. Okay. They can reason through to physical health too. I was actually surprised by that. I would have thought that came first, but no, financial self-sufficiency first, physical health next. What's missing? Emotional, mental, spiritual well-being, social connections, right? So it's still a very narrow view. So we just need to be aware of that. And I'm going to show you some ways that we can navigate around that. What undermines well-being? What can get in the way of it? So we want to make sure that we are not queuing up this very easy thing for the public, which is that it's a lack of willpower or grit or resilience, that it's all about individual psychology. The public can also think that it's about bad parents. So why does that person have a lack of grit or resilience or willpower? Well, they had bad parents. And that keeps everything in the private sphere. There's no interest in public engagement in what happens in a family. It's a regrettable thing. And then there's also a sense that communities are very dangerous places that we have to be protected from. Where we want communities to be a resource for people, for engagement, right, for their health and well-being. So that's a challenge for us. How do we improve well-being? You're going to hear me say this over and over and over again today because it's just so important. But we really have to be careful about queuing up this idea that individuals are responsible, because that's the easy to think thing for the public. There's a sense that in an ideal world, the government would play a role in fostering well-being. But in this world, they are too inept and corrupt to do so effectively. So this is true, for our policy and advocacy messages, for example. When we talk about failed government, failed policymakers, failed systems, even though we might really feel that way, the public already believes that, so they're not going to see that there are any solutions that can come from that. And then this could be productive, except it's not quite enough for us yet, this idea of informal networks. The public has a very exaggerated belief in how much friends, neighbors, extended family, your churches and synagogues can, houses of worship can step in to address well-being when it gets broken down. Takes a village, which is great, except it's always somebody else's responsibility. And it also ignores the formal network of human services that does exist. So what are human services and how do they work? I spoiler alerted you with the cognitive hole. Public doesn't know, so when they have to think about it, they think about direct services that are done primarily by volunteers, really kind, compassionate people who don't necessarily have an expertise that they're bringing to the table, right? So kindness and charity doubles down on that. And only the basics and only temporary. And in fact, our services have to be temporary, because if they're not, they will undermine willpower, which is critical to well-being. So these are the big kind of challenges, communications-wise, that we are up against. I'm going to show you a few ways that we, common communications strategies that we use that can queue these up. And then after I've inundated you all with the problem, I am going to share the solutions with you that we've discovered in phase 2. How's everyone doing? Overwhelmed? Okay, good. Okay, so here's some common communication strategies that we use that can make it really easy to queue up those gators in the swamp, which as framework says they will eat your message. So vulnerable, needy, at risk. We use these terms a lot, particularly vulnerable and at risk. Anyone want to hazard a guess of why that could be problematic for us? Yeah.
It's couching the descriptor of the populations that we're there to serve as an individual deficiency on their part.
Perfectly said. It's an individual deficiency on that person's part. Yeah. Yes. It's othering. Nobody wants to be described as vulnerable. It's somebody else, not me. So sometimes we try to do the flip side of this. We ramp up the worthiness of the people that we serve. They're workers, they're hard workers, they're children, right? And think of the children, yeah. Or we talk about how we're empowering them. But it's just the flip side of the same thing. Still about that individual. It's one thing to talk about empowering communities. It's a very different thing to be talking about empowering a person. Because it's very easy to say, well, nobody had to empower me, right? So just being aware of the ways that we make it us versus them. We talk about charity, we talk about being a part of a charitable sector, we talk about how kind and compassionate our workforce is, and those can all be very true things, and I think we all want to believe that about ourselves, but we really need to start conveying the sense that we have something more that we're bringing to the table than just our kindness and our compassion. We tell a lot of individual stories out of context. So we have a belief that vivid, compelling stories about people who have gone through our program is enough to engage people. It can be a part of the story. But if we don't provide context, why was that person engaged in the program to begin with? How did it happen? What was happening in that black box of the program, right, specifically? If we don't explain that out for folks, then it's very easy just to default to what that person did and the steps they took. We can become invisible, and they have a hard time seeing how this can be expanded out to other ways of thinking. Other people in the community, themselves, right? It's about that person and their heroics. This next bullet point is hopefully not something we use in our fundraising, but it's definitely something we use in our policy and advocacy communications. We're argumentative, we're snarky, we shame people, we tisk our policymakers if they don't agree with us. That does not invite a conversation that's productive. Instead, we could be explanatory, we can maintain a reasonable tone. We want to convey that, look, this is something, we're pragmatic, we can do this together, right? And then there are a lot of myths about, and you heard them in the videos, who's benefiting from human services, why, what did they do, what didn't they do? But if we spend a lot of time just kind of repeating those myths before we dispel them, first of all, we're just giving up a lot of oxygen to that myth. We want to provide the correct story, but we don't want to give a lot of airtime to what the myth is. So those are just some common things that we do as a sector that can cue up the swamp. Does that make sense to folks? Anyone want to push back on anything, throw anything at me? Not the apples, they're too hard. Okay. All right, so let's talk about the solution then. So framing is a storytelling device. It is making choices about what you focus on and what you kind of put to the background in your story. And we do this all the time, not always intentionally. So we're going to talk about some of the backgrounded stories that we want to highlight and focus on for the public that are deeply important to our sector, but that the public is not aware of. So we need to spend more time on. Not a set of talking points. It's not a slogan, right? It is a storytelling process. And it's research-based. So this was phase 2 of our work with Frameworks Institute. They, again, went out to the public. They did a nationally representative survey, close to 5,000 people. And so when I say nationally representative, that sample means that it's nationally representative across demographics. So gender, race, voting age, partisan ideology. And what we wanted them to find, they did a randomized selection. You either got exposed to one way of telling the story of human services that we thought could work, a second way, a third way, or no control, or no primer, so the control, like what do you currently think? And we wanted to see improvements in the public's attitudes about human services, improvements in their knowledge about what human services encompasses, so that it's not just this very direct temporary service. And we wanted to see increased support for public policies that would support human services. That's what we wanted to find from this narrative, from this story. And it was all to fill in this storytelling arc. So this is the arc that we want all of our stories to follow. I'm going to fill in each point in this arc for you with specifically what we found works. So why does this matter? We always want to start our conversation with the public and with policymakers with why this issue should matter to them. So it's not the crisis that we're in, it's not the population we serve, it's a value that's going to orient decision-making for them for the rest of the conversation. And then, well, how does this work? What specific metaphor can we use to describe the work of our sector, to describe the work of our organizations, to describe why people might need to access these services? What specific metaphor, not just any metaphor, but what specific metaphor worked? And then finally, how can we close out the conversation with a conversation of solutions? What's the most effective way to couch our solutions to the public? So I'm going to walk through each point one by one. So what's the value? So in Frameworks research, what they found was the value of human potential. And we heard that a lot today, so I was very excited in this morning's session. So human services help everyone reach our potential so that we can all contribute fully to our communities. This was the most productive way to start the conversation with the public about our work. And there are a few reasons that, yes? Okay, hold that thought. Okay, so why was human potential a productive starting point for the public? So a few things that it gets us around. First of all, without very much explanation, people automatically see human potential as something that's more than just getting a job. It's not just economic success. There are all kinds of ways that we can be tapping into gifts and talents of our neighbors and the people in our community. It's very inclusive of a range of interests and a range of abilities. So people get that potential is going to look different for different people. And people kind of intuitively see that without, again, much help, that it's going to be valuable to the entire community if we are tapping into the potential of the people who live in our community. Yes?
While the clients that I may serve as condition may never improve, potential adds for the funder the possibility. I mean, the funders like to see that potential or know that there is a potential for bringing that client to the best of their ability.
Yeah. Yeah. It's very hard to disagree with as a concept, that we are not going to benefit if we're trying to help people access their full potential. So I'm just going to give you an example to demonstrate how you can use this. We have partnered with an organization in New York called the Human Services Council. And they're actually very similar to the National Human Services Assembly in this way. They are a membership organization that focuses a lot on policy and communications for their human service members. And they decided that they wanted to reframe their mission statement. So this was their original mission statement. We strengthen the not-for-profit human service sector's ability to improve the lives of New Yorkers in need. What do you guys think they wanted to change about that? Why do you think they wanted to change that? Yeah. Yep, exactly. Who benefits? New York is in need. It's negative. Yeah. So they decided to reframe it. They worked with their board on this. They wanted to incorporate this value, and they wanted to keep it specific to values that they held dear in New York. So here's what they came up with. We strengthen New York's nonprofit human services sector, ensuring all New Yorkers across diverse neighborhoods, cultures, and generations reach their full potential. Was that a good? Oh, good. So, not a huge overhaul here, but a shift from people in need to everybody. right? So that's just to give you a tangible idea of what this can look like. So, and I should mention, the value of human potential, that was tested against things that are really dominated in this field. Things like compassion. They tested it against compassion. They tested it against opportunity for all. They tested it against self-sufficiency. They tested it against pragmatism. And this was the most productive way to start the conversation. In fact, opportunity for all depressed support for policy. Isn't that crazy? I thought it was crazy. We thought it was going to be the big winner, so we were surprised. This is why we test. Okay, so we've initiated a conversation around human potential. But now, of course, that's not the end of the story. We have to explain what it is that we do as a sector to get us there. So we use metaphors all the time in our language to explain, give people a general idea about something that they have no idea about. So what is the metaphor that frameworks found works the best in explaining what human services do in communities? It's this idea of construction. That well-being is something that is built, and it's something that can be undermined over time by things like shaky foundations or really bad weather. So how does this work? It's built, it's maintained, it's repaired over time. That's a metaphor that really helped the public understand more than just the remedial basic needs of people in crisis. And I'm going to talk a little bit about that. Well, I guess I'll talk about it now, some of the powerful things that it does. So first of all, people intuitively know, without much explanation again, because in this society we generally know how a building works, right? We know that you don't just build a house and walk away from it. We know that it requires maintenance over time. We know that it might need repairs over time. We know that external factors, like bad weather, can undermine it over time. So it gives us a way to describe our work as more than just the individual and temporary and crisis. We, as a sector, can become the architects. We can become the tradespeople, right? We can design blueprints. So we can use construction to talk about ourselves as professionals, because people understand in construction that that's what you want. You want architects, you want engineers, you want professionals who have a lot of experience. We can become those professionals. And nobody anymore builds a house on their own, all by themselves. So it's a sort of barn raiser mentality that we want to tap into. That it's communal responsibility, that there are multiple people coming in at different points. Just to give you an example of what this can look like. We're partnering with several communities in Illinois, including Peoria. And the Human Services Collaborative of Peoria had an opportunity to write a column for a local business journal describing what human services are and why the business community should care. And they used this construction well-being narrative to do that. So this is a long one, but it's important because I think it gives you an idea of how it can be done. I'm just going to highlight a few things that I like about it. In the first sentence, they talk about enabling everyone to reach their potential and fully contribute, so they've got that value as the start. Well-being is built just like a home is built. From the value, they segue to how we get there. It's not a collection of boards and nails and shingles. It contains those pieces, but more. It doesn't become a great place to live until everything is correctly fastened together. Just as that happens with a house, similarly, a community provides well-being when everyone can access economic stability, as well as educational, cultural, and social opportunities. Everyone has medical care, everyone feels cared for and safe. Only then can individuals reach their full potential. So that's how they chose to use the construction metaphor. Human services is not just something that's operating in silos, it's something that's interconnected and fostering well-being in a comprehensive way in this community. And they describe well-being as more than economic well-being, right? They talk about educational, cultural, social opportunities as all being included. We've been working with some folks in Austin for the last year and a half, and They had an opportunity to provide some thoughts to the mayor on talking points that he was going to use for a mental health event that he was speaking at, and he did. They have a trusted relationship with him. They shared some reframed talking points with him, and he used this. Our community is so much stronger when everyone has access to the tools and support they need, so everyone can contribute to their fullest potential in our city and our community. Tools and support. It's a very quick way to get to construction metaphor. Here's what we don't want to do anymore. This is a metaphor that has dominated the way we talk about our sector and explain our sector. Why do you think it's problematic for us? Yeah.
I'll borrow a line from my uncle at Thanksgiving, because it incentivizes people not to work hard.
Because it incentivizes people not to work hard. Mm-hmm.
It demonstrates that the work is transactional, not building the person.
Mm-hmm.
That they can just keep taking and never improve and never grow or never want to change. But if we're doing our jobs correctly, we are helping them grow and building that well-being with them.
Exactly. So it's transactional, and it's not something that's promoting health and well-being over the long term. It's sort of being there in the moment, but not providing any kind of resources or support to foster well-being going forward. Yeah.
If you're in a safety net, it's because you messed up.
Yes, that exactly. How do you have to end up in a safety net? You messed up. Okay? Not that you live in a town that has been reliant on an industry that's dying, right? Not that you have a family member with a health crisis that you're working through, right? You did something to land in this, and thank goodness we're all here to catch you. It's not a very accurate description of our sector, so we just really need to let it go. Does anyone want to push back on that? Let it go. Okay, good. The other challenge with the safety net that I'll just mention is that it has, over time, it's aligned with a particular partisan ideology. And we need to be able to engage support across partisan boundaries. But it's a really quick way for people to shortcut whether they support you or not. Because political ideology is a really important way that people take shortcuts in their thinking. Yes?
Where would you feel the phrase quality of life falls with well-being and potential?
I think quality of life can fit with well-being and potential. I don't think it goes against the recommendation. I mean, just like anything, we need to describe what we mean by that. The quality of life could fall into the same trap that well-being does, which it could just look like financial quality. So you just need to explain what you mean by that. Yeah, yeah. I'm sorry, in the back? Did you have a? Oh, no. Okay, so here's another one that Frameworks tested for us. They tested this concept of pathways or roadways, journeys, as a metaphor that we could use, and it was not helpful. Why do you guys think this one could be problematic? Mm-hmm. Because success should be defined differently for everyone, but this suggests there's one path to get there. It also suggests we all have access to that same path. So it doesn't give us a good way to talk about context and environment.
If you're not moving forward on it, not to repeat myself, sorry, but it's your fault.
Yes, no, exactly right. No, you get it, man. If you're not moving forward down that path, it is your fault. This is really, really important because this is exactly what the public believes about our sector and the people we work. And so I feel like I'm, beating the drum on this too much maybe, but the individual aspect of our work is something we have to navigate around very carefully. Okay, so how do we close out this story arc? So we have engaged people with this idea that everyone should be able to reach their full potential. We're all going to benefit when that happens. We've explained how that happens, that well-being is something that is built over time, and that experts can come in and help repair it when it breaks down. We have talked about the context that can undermine well-being, not the person. We're not building people, right? We're building well-being, so the context that can undermine that, and how we can talk about things like shaky foundations and life storms. And I'll actually mention, this is one of the reasons, by the way, that we know that the construction metaphor is really sticky for the public. It's something that the public can really grab onto in a way that they haven't been able to with previous metaphors that we've tried. So Frameworks, as part of their testing of a frame, when they narrowed it down to what they, the option that they thought could work, they put it through something called persistence trials. This is to really see, okay, we think on paper it works. Now when we actually have a conversation with people outside of the sector, does it? So Frameworks would get in the room with 2 people from the public, didn't know anything about human services. And Frameworks would describe human services using the construction metaphor. Then Frameworks would leave, and 2 new people from the public would come in. And the folks that Frameworks had talked to about human services using the construction metaphor, they then had to explain human services to these 2 new people, just based on what they learned from Frameworks. And they were able to do that. And they were able to do it so well that they were actually able to extend the metaphor in ways that Frameworks hadn't done with them. So it was the public reasoning through why people would need human services using the construction metaphor that came up with things like life storms and shaky foundations. That wasn't Frameworks spoon-feeding them to them. So we know that it's a really easy thing, they call it sticky, for the public to kind of grab onto, that they haven't had yet for our work. So how do we close out the conversation with them? So again, if we want to normalize what we do as a sector, make it less about them, more about us, and if we want to demonstrate that it's not just temporary services for people in crisis, what Frameworks found is if we talk about how our work impacts people over the course of a life. They call it Lifecycle Examples. This is where we can drop our jargon and explain what we mean by our shorthand. This is where we can provide examples that go beyond direct services, so we can talk about prevention, we can talk about planning in addition to talking about remediation. And this is where we talk about the diverse array of recipients. I'm going to give you an example of what this can look like. If I see some people taking pictures. Okay. So here's what it looks like to use the life cycle example. I took the name out of the state, or the state out of the name because I didn't want to distract people with it. This is a good example, though. This is a good example. So our state relies on nonprofits to build and support well-being, so our residents have what they need at every stage of life to do well socially, emotionally, financially, and physically. So that's well-being being defined as more than financial. This includes, and then they give some, this is what I call the such ases. This includes some examples that then help people understand. So that includes things like early childhood services that establish a solid foundation for health and development. That includes providing safe places and social resources that teenagers need to thrive. It includes making sure that adults have access to good jobs and affordable homes. And it ensures that older adults are able to remain connected in their communities. Now, you don't always, in all of your communications, have to list out specific examples across the lifespan. You can just say, our work helps people across the lifespan. But this is a way how you can, this is how you can unpack that for people. Does that make sense to folks? Oh, okay, so we've gotten to the polling part. I was so excited to use this, and hopefully it works. So you guys all have, I think, in your app, a way that you can take polls, right, and answer questions. So if you go into your app for this, and go into this session, you will see this question. It's a pop quiz. I want you guys to read. Oh, look, it's already happening. Which one you guys thought was more? I wonder if it's possible to keep the slide up for people who are still reading. Thank you. So which one do you guys think is most strategically framed using the life cycle examples? All right, maybe we can see the poll now. Okay, you guys did pretty good. You did pretty good. Oh, you're improving. Oh, you're getting better. Oh, good job, you guys. Okay, so let's go back to this slide. So 70% of you selected B, oh, some of you are cheating. 72% of you now. Good job. Okay, so, but some of you selected C, and that always happens. And there are subtle differences that I want to point out to you between B and C. Let's start by getting rid of A, though. So A, violence threatens Americans in every stage of life. Infant neglect, childhood trauma, elder abuse are occurring at epidemic proportions in our society. The reason I do not think that this is strategically framed is, again, it's that crisis, negative language that shuts people down. This is what people think. Communities are scary places. Violence threatens Americans every day. Okay, but B and C, the differences are a little more subtle. So what do you guys who selected B, why did you select B? Anyone want to volunteer? It's all positive, all the statements. So we're not just decreasing absences or reducing crime as adults. We're staying engaged throughout life. Yeah. What else? Yes. Yes, we language. We language is super important in this. It's not just the children who participate in early learning programs. It's how we all benefit because that's happened, because we've established a strong foundation for lifelong learning. So I did public policy and advocacy work on early childhood issues for a long time, and one of the challenges that we had is, we could leave people with the impression that, say, participating in Head Start was it. That's all you needed, right? You participate in Head Start, you're good for life, right? And so C can kind of lean into that, because children who participate in early learning, yes, they do have benefits throughout their lifespan, but those benefits have to be bolstered at different points in our lives. So the B example talks about how you build on it. You start there, but you don't end there. So it's a sort of sequence of events that has to happen. Does that make sense to folks? Okay. Good job with that, you guys. All right, so I want to show you an example of how you can put this all together just very quickly. So we worked with the Alliance for Strong Families and Communities as one of our national partners on this initiative. And one of the things they wanted to do, they were coming up with, for the first time, a really comprehensive public policy blueprint. They've had policy agendas, legislative agendas before, but they really wanted to take a step back and say, what do we really stand for from a policy perspective? So that's what this blueprint does. That's what this blueprint articulates. And they wanted that to be really well framed, because they're going to use this for a long time. So a few things that I just want to highlight in blue here. They talk about how our country thrives, communal benefit, when everyone's able to reach their full potential, right? They talk about how they do that by building, maintaining, and restoring physical, emotional, social, and economic well-being. And then they use the construction metaphor to talk about the foundational and structural building blocks that all families and communities need, not just some people. We all need these to foster well-being over the lifespan. And then they unpack what that is. It's employment, it's affordable preventative health care, it's healthy, livable homes and safe, secure neighborhoods. These are things that we all want and all understand we all need. Safe, stable, nurturing relationships, an educational success that begins with nurturing and supportive families, continues with early childhood development through post-secondary achievement. So those are their life cycle examples of the building blocks, the construction metaphor, building blocks of well-being. And then, of course, from here, they go on specifically to talk about, well, what are the policies that get us there? And I love the cover that they chose. So our images matter almost as much as our messages do, right? And what I like about the cover that they selected is it's a lot of different types of people coming together in a public space. So it's collective action. So why do we feel so confident that this narrative improves public support and understanding of our work? Because we have the research to back it up. So when frameworks tested, and I'll just walk you through it, when frameworks tested the value of human potential, we wanted to see increases in the public support for prevention, for remediation, for planning and research, and then for that red line, importance and efficacy. We wanted the public to believe that our work was a priority because what we do works. We have solutions. So if you just do human potential on its own, you do see increases in the public support for prevention, remediation, planning, and research. But it does not help us on its own to convey importance and efficacy. And I tell you guys this because we cannot just name drop human potential and think that that's enough. It's a starting place. It's an opening for a conversation. But once we add in the construction metaphor to define how we do that, you see big increases. Now with that white asterisk, you get statistical significance in the public support for prevention, remediation, planning, and research. And a little bit of a bump now on yes, it's a priority, yes, what you do works. But when you do that full narrative, that full arc I told you about, human potential, construction, over the course of a life cycle, when you do that full arc, you see big, huge increases in public support across the board, and finally getting statistical significance on this idea that we should be a priority. So those numbers are really compelling to us, but for frameworks, who has been working in this sector and doing this strategic frame analysis now since 1999, when they crunched these numbers, when they did the analysis on this and found this big bump in support, they let us know that they had never seen the public move so quickly on an issue when exposed to a new frame as they did with the public was exposed to this one. So we know that it's a powerful narrative, that it's something that can help the public have a very new and different understanding, a more accurate understanding of the work that we do as a sector. So, oh, I see a lot of hands, yes. We'll start here and then we'll go to the back. The gentleman here with the... So phase 2 of the research was done it came out in 2015. Yeah.
I'm just curious, with younger audiences who are looking for more data-driven information and factual information and statistics and whatnot.
Yeah.
You showed the example where it was the 3 different ones at the top, appeared to be more negative, but it's talking about the reality of violence,
Yeah. Yeah.
Create this story that ends up feeling like a lot of fluff.
Yeah.
And that's not what younger audiences are seeking.
Yeah, no, it's a good question. So the question is like, where does the data go, and where, we do have to define what the problems are that we are trying to solve. So where does that fit in the story? And context matters, so we have to establish that first. So where it fits in the story is you establish with the human potential, you explain how well-being is built, and then when you're talking about how it can be undermined, that's where you put that information. And then you always want to convey at the end that there are solutions for folks. But yeah, it kind of fits in that third point in the arc. And then back here, and then come. So it was nationally representative. So it was tested in a nationally representative of voting age. And then what was the first part of your question?
The saturation.
Oh, the saturation. Yeah. So we want to have a cohesive voice as a sector. We currently saturate with language like vulnerable and safety net. That's the saturation that's happening right now. But construction, I'm okay with us all talking about building well-being because that's a more accurate sense of what we're doing. We speak with the same language right now. We can continue to do that. We just have to use a slightly different narrative. And then as far as tested for reading age, I'm not sure.
So I know that it was tested representative sample, but
it moves the needle for the general population. So it wasn't tested, like specifically, does it work with a community of color here in this neighborhood, or does it specifically work with X population? It was tested, like I said, nationally representative. So general population. Yes?
I was wondering, this might be a little off topic, but could you discuss like the relationship between this funding for these programs and the sense that people have of entitlement programs?
Mm-hmm.
You know, the relationship that like people get entitled,
Mm-hmm.
you get stuck in that rut.
Mm-hmm.
How can this improve that whole, those three areas together?
They're very much related. This idea of how we fund entitlement programs, even that term, entitlement. So they're very much related. So first of all, it's helping to explain why people need to access those supports and explaining why those supports are helpful to all of us. It's making those same connections. I would step away from using the term entitlement. But they are connected. These are linked concepts. I want to get to my kind of bigger point on this. So kind of key takeaways. So we want to get away from letting the public define human services, because they do that in a narrow way. We want to provide the fuller, broader picture of what we do. And we want that to include the fact that we're skilled and essential as professionals. And we're not just volunteers who are doing this out of the goodness of our hearts. We are not just a safety net for the vulnerable. We are all kinds of support for different types of people at different points in their lives. And then we've really convinced people that there are problems. We have not convinced them that there are solutions. So we just need to flip the balance of our discussion away from being so problem-oriented and have it being much more solution-focused. So a few things to remember: we're not our audience. So remember who we're talking to and understand that there are limited understandings. We have a way to give a fuller explanation. We can stay reasonable and pragmatic in our tone. We're going to get a lot further with people. Lead with the value of human potential, but don't stop there. Use the full narrative if you want to have the most impact. Some ways that you guys can get started on this, if you're interested: Frameworks put together a toolkit for us. In that toolkit, you will find sample messages, sample testimony, sample letters to the editor. You'll find frequently asked questions. You can find all of their research. So the research reports that they did for phase 1 and for phase 2 are on there. And of course, we have, you can't just listen to one presentation. It's a lot to kind of change and shift. So we have developed a resource that we put out through our newsletter every other week, where we provide tips on how to apply, and we provide samples on how people are applying this reframing. You could request a workshop where we do more hands-on training for your staff or for your community coalition partners. And then you can go there for additional tools and resources. These slides, I think, are available to you guys on the app. So you should be able to get all these links from that. And then you can contact me. Okay, so yeah, we have time for a few more.
What was there was the first website, the reframing, or the tools that you can use for messaging?
And I will say, everything that's on there, all of the sample messages that are on there, you guys should feel free to, if you see language that just fits exactly with what you want to do, you can just use it. There's no such thing as plagiarizing for that resource. Copy and paste. We want to start talking like we are a cohesive sector. What else?
So shifting the mindset or the support of the human services that we do, the social sector, what types of call to action do you have for the general public? Because it's one thing to have the support, but then how do you get financial people giving you money, taking action, volunteering for you? Like, how do you kind of bridge those two things?
How do you bridge? I'm not sure I understand that.
So how do you take advantage of the public shift in mindset
does. So shifting. No, it is. I mean, so what we know through this research is that the public is going to be more engaged in our work if they understand it more fully, and more likely to support us financially, more likely to support us from an advocacy perspective, more likely to volunteer, right? So they work in concert with each other. Yeah, so you can go to this website, and all the research that they did for us is on there. Yeah, yeah. What else? Yes.
So I write a lot of grants, and we are mostly funded by foundations. And so on our website and in our documents, we try to remain very positive, and we're not perfect, but we're on the right track. It looks like after today. But where I get stuck is when I write for grants to foundations who tell me straightforward, you need to use these words.
Yeah, this question comes up a lot. It's a big challenge for us. So funders want to hear what you just learned is not helpful. So how do we address that? So yes, some of it is having frank and honest conversations with funders. That's something that we have as part of our plan to be more strategic around, is engaging funders as the sort of next cohort that we try to work with. So because they're obviously, it's not, they just don't know. They haven't been exposed to this as well. And then I would say, if you can see where you can start to weave the story in while sort of honoring the questions that they're asking. But yeah, the second part of your question, does it take some probably leadership and guidance from you? Yes, I think it will. Because we're talking about a major culture shift for our sector here. And it's not going to happen overnight. What else? Yeah.
So if the public is swayed by what you're doing,
Yeah.
your work, why aren't funders going to be swayed?
So I think funders will be swayed. And that's been our experience. It's just been exposure is the challenge. Yeah. Yeah, in the back.
I serve on a state board, and what we're finding from HHS, our state health services, is they're changing the name of what we are. We're no longer a partner or a provider or a subcontractor, and from our board perspective, we also see that they really want to look at public, private companies instead of using not-for-profits to see if that works any better. And they're really giving them an advantage over what we have to do with clients and what the private company does not have to do with their clients. So it's not just getting our message out, it's dealing with a state organization that's just to be supporting the not-for-profits they've been working with.
No, that's exactly right. It's not just about kind of messaging. It's about changing the way people understand how we function as organizations and what we need to function in a healthy way. Yeah, absolutely. It's not just about the kind of funding piece of it. It's how are our contracts structured? Do they treat us as professionals like they treat other parts of the world, of the sector? Yeah, that's all part of this. Giving people a better understanding about why that should happen. Yeah.
Have you guys seen or observed, or are you anticipating challenges to this frame? Because we in this room are involved in advancing the cause of human dignity.
Yeah.
We're in the nonprofit sector. There is a for-profit sector. There are people who profit from establishing confusion and diminishing and denigrating the work that we do.
Yeah.
Have you guys looked or explored or anticipated any challenges to that, or what should we be prepared for as we reframe on this line there?
So, a couple of things on that, points on that. First of all, we can't really control that much what other people are going to say about us, but we can control what we have to say about ourselves. And we can be very targeted and focused on who we deliver that message to and who we're engaging. What the frame will do is it will help us activate that sort of sensible center, but it's not necessarily going to change people who are active critics of our work. And I wouldn't set that expectation for us around that. But it does give us a way to engage more people than we've been able to engage, and it gives us a way to provide the complete story that makes it harder for the naysayers to kind of shoot us down. Look, they're just a safety net, they're just there to help people when they fall, they're not effective, they're inefficient, right? This gives us a story that helps us provide the accurate story of what we're doing. Well, I want to thank you guys so much for spending your afternoon learning about reframing. We're really excited about having this research-based approach to communications, and we really would love for you guys to check out the website and see what you can find and follow up with us if you're interested in learning more. Like I said, we do half-day workshops where we really dive into practicing what this could look like, using it flexibly so we don't all sound robotic about our work, but it feels more natural to our organization and our missions. So please do kind of follow up with me if you'd like to learn more about it afterwards. And thank you so much for having me here.